One night of bad sleep is inconvenient, but chronic sleep disruption, that's a metabolic and neurologic liability. Sleep is not a luxury, it's a cornerstone of human health, and when it breaks down, so do systems across the body. At Bioprime Medical, we assess sleep as part of our core diagnostics. We use a combination of patient-reported outcomes, wearable sleep data, cortisol melatonin rhythm testing, and when necessary, sleep studies. When sleep is fragmented or insufficient, we see downstream effects: elevated cortisol, impaired glucose metabolism, hormonal dysregulation, weight gain, and even mood instability. Our treatment protocols are customized based on your root cause, whether it's circadian misalignment, stress-induced hyperarousal, nutrient depletion, or perimenopausal transition. We may recommend targeted supplements like magnesium glycinate, L-theanine, or low-dose melatonin, behavioral reprogramming, or more advanced options like peptide therapy for deep sleep enhancement. By improving even 30 to 45 minutes of restorative sleep per night, we see measurable improvements in energy, focus, metabolism, and cardiovascular risk. Sleep optimization isn't optional, it's foundational.